sort of the annual meeting, if you will, for our Health Action Partnership. It's been a great year. We've got a lot of great things to talk about, and I see it's so fun to get us all together in one room, because I go to a lot of the different priority groups and committee meetings, and I get to see everybody. I never get to see us all together, so it's great to have us all back together to talk about the day. We got a great lineup today, but one of the things that we're going to do, in addition to sort of learning about what everybody's doing, what's happening across the whole partnership, where we're headed, where we've been, we're also going to, we have a theme each year, and today we're going to focus fairly heavily on health equity. Our speakers are going to be talking about health equity. We're going to be launching some products around, we call them products, but they're some tools that you can use in each of your work to line up and understand what health equity means, understand how health equity can be incorporated into the work that you all are doing. And so hopefully when you leave today, in addition to being updated and energized about the work of the partnership, you'll also have some new tools and some new thoughts about how you can incorporate health equity into the work of your various committees and organizations. So it should be a great day. And then finally, we will hear from the priority group leaders in each of the priority groups that are working, just to give you an update on where they are, what their plans are, where they've been, and what they hope to accomplish in the upcoming year. So we're going to jump right into it. And what I've been asked to talk about before you hear from our first speaker is to talk a little bit about the Bold Goals Coalition. And by show of hands, have anybody heard of this effort called the Bold Goals? Okay, quite a few of us. And you know what the Bold Goals Coalition is, it's based on this idea of collective impact. And I'll give you a quick summary, and that is it's some 200 plus organizations that have come together and said we want to try to move the needle in our region and our communities on specific issues. But we don't want to do the old kind of collaboration where we all sit around the table, we speak earnestly for an hour, we leave, we come back 3 months later and have the same conversation. We want to actually work in alignment with each other, have measurable outcomes, and start moving together towards moving this larger community needle. And that's what the commitment is within that partnership. It's an open table. We have lots of partners continually coming in. It's nonprofits, it's corporations, it's funders, it's government, all coming together and saying, how do we take the resources that we have and work in better alignment against common goals with measurable objectives? And so, you know, there are different kinds of impact, and this idea that this individual impact it's good. I mean, good things are happening here. People are getting help. You've got lots of individual organizations working together, yet we're all working somewhat independently of each other. We may share an idea here or there, we may share a client, but for the most part, we're working independently. And all trying to work on the same problem, but doing it independently of each other. Then you've got what we call coordinated impact, where we all say, okay, hey, let's all work on the same issue. Let's all focus on one specific issue around health, but still doing it in our own independent way, with our own strategies, our own measurements, our own everything, but at least we're working on it with each other and working on the same direction. And then the concept that the Bold Goals Group is based on is what we call collective impact, where you have all those same organizations working towards the same outcome, using the same data, and using that data to keep sort of continuously improving their outcomes. So it's not a magic bullet necessarily. It's not a, we've done this and it's now done. It's more of a way of thinking or a strategy on how to work smarter as a community and to work in a way that starts to actually yield some results and gets us moving the needle. And so that's happening, and it's happening specifically in the health area. The Health Action Partnership and the Bold Goals Coalition have sort of come together and adopted each other's goals, if you will. And an important tenet of this collective impact work is one. Well, one is setting a common goal. And the goal that where we've come together as an organization, as a group of organizations, is we were trying to say, what's the needle we're trying to move? And we spent a lot of time talking about this, and there are a lot of metrics in health, more than almost any other thing. And there's so many metrics, we all want to move all of them. But also we said, what's causing us a lot of pain and concern? And it's, well, we're continually ranking in the bottom of these surveyable metrics. And so we started looking into what are these metrics, and it's really the Robert Wood Johnson Foundation does this community health rankings, and they look at a whole lot of community health metrics every year by county, and they put out these rankings. And we said, what would it take if if we tried to move that metric? How could we move our community, our 5-county region, to become the top 10 health, be in the five counties, for those 5 counties to be in the top 10 healthiest counties in our state. And by the way, we have the healthiest county in our state, in our region, and we have the 60, I think second from the bottom or close to the bottom in our state, in our region as well. So we've got some disparity geographically and some opportunities to really improve. And so from there, we started sort of breaking it down, saying what are the things that are causing the heaviest things that are weighting down our performance in health. And it might be that something was weighted very heavily, like smoking, for example, or it may be that that's something that maybe wasn't as heavily weighted, but if we could move the needle on that, it would have a ripple effect of a lot of other things in the community. So we started looking at those, and as a group, we started coming up with some metrics. And I think at your place, you've got a trifold. It says Bold Goals Coalition. It looks like this. And you can see in there, it covers all 3 areas of education, health, and financial stability. But the health is highlighted in blue. And if you were to look there, you can see some of the things, the metrics that we're focused on moving as a group. And some of the key strategies. It's a great piece, and you can see there's a good piece of data, and I welcome you to take it with you, look at it. You can also, if you see on the back, on the front there, our website is boldgoals.org. You can go to boldgoals.org and see all kinds of updates and real-time information on what's happening in the various priority groups and what they're working on. The other thing that we've been busy at in the last year doing with our with the Jefferson County Health Action Partnership and our Bold Goals work, this collective impact work, one of the key components of it is that there's an organization that steps up to be the backbone organization. This is the group that says, we're going to help staff this and drive this and make sure that the meetings are called, the agendas are set, that people who say they're going to do things, we'll follow up with them and make sure that things are on track and getting done. It's really sort of think about it in the volunteer world. The backbone organization does the staffing work for all the various committee leads. They don't chair the committees, but they provide that underlying staffing to help those committees all work more effectively. And the way the Jefferson County Health Action Partnership's been set up, that leadership rotates between the Jefferson County Health Department, the United Way, and the Community Foundation of Greater Birmingham. We've been sharing that backbone among the 3 of us. But what we realized as we got into this is the way we had it set up originally was we would have a backbone organization providing the staffing work, but then each of the priorities were sort of led by individuals who had an interest or an expertise in that area. And the challenge was there's so much work to do in each of these priority groups that we felt we really needed organizational leadership behind each of these priority groups. So we spent a little bit of time in the year thinking about what are the groups, the right work groups that we need to have, and these are the ones: advancing health equity, optimizing healthcare, improving mental health, improving the built environment, transportation and safety, and promoting healthy lifestyles. So these are the priority groups where work is getting done. So these are, in essence, sort of the subgroups or work committees. What we did is, working with partners, we were able to get a number of organizations to agree to be the organizational lead, if you will, the organizational backbone group to help staff and drive the committee work. So there are resources behind it. As before, it was a sort of a person. Now it's an organization. It's still made up of lots of partners and individuals with expertise on these committees. But now these organizations have agreed to put their expertise and their staff resources to help drive the work. And so, let me make sure I don't make a mistake here. For mental health, the mental health priority group, the Community Foundation of Greater Birmingham has agreed and has started providing backbone support for that group. The Jefferson County Department of Health is providing the backbone support for the optimizing healthcare. The Jefferson County Collaborative for Health Equity, which used to be called Place Matters, they have taken on the health equity piece. You're going to hear from them in a little bit. And then both the YMCA of Greater Birmingham and Alabama Department of Public Health together are providing backbone support for the Healthy Lifestyles Work Group. And so we're excited about this setup. These organizations haven't necessarily said, they've stepped up in a major way to provide resources and staff resources to help this work go. So I think the model that we've come into is set up to be sustainable and be able to run for quite a while. So we're very excited about this setup.